did recording. I started the recording. I don't know why you didn't say that it is. Yes, it's recording there. That's fine. We're good. We're good with recording. You scared me. Ay. Okay, let's look.
No, it disappeared when you let people in. It disappeared. That's why.
Ah, I see what you're saying. Okay, so good. We record. No problem.
Okay.
We're recording. So scanner devices operating characteristics. So this is all your parameters which you're going to be using. This is all on your scanner. On some scanner, like a Scanner Pro or scanner with presets, you will have pretty much all of them. With the home scanner devices, you will have less parameters, but we will talk about this too, how you work with the home scanner if you need to. So energy, frequency modulation, intensity with gap, using together usually, amplitude modulation, damping, swings, mode of biocontrol feedback, dosing modes and diagnostic presets. That's all whatever scanner has. And people who don't know how to work with energy, frequency, like what to put, we have other seminars which were given, and you can take those seminars to learn how you work with energy, like what person will get which energy, what condition will get which energy. We will be talking here also about energy, but if you want to know more, there are pre-recorded Zooms which you can buy with Tamara Goncharov at the Scanner Rhythm USA. And you can learn more when you're using which type of damping, which type of swings, which type of other things. Okay, we're not going to discuss it today, otherwise we will never finish today. And the way you start to work with setting up the parameters, you start with energy. You put the scanner on the area which is close to the area you're going to be working, and this area has to be with the same kind of sensitivity as the area you're going to be working with. And you increase the energy to a certain time, like to a certain place, so you know approximately that the patient feels it, right? Lightly, not necessarily too much, but lightly feels it. And then you can already add the frequency, you can add intensity and gap, frequency modulation, amplitude modulation. And after you did this, you also will go back to energy and you will adjust it, because sometimes it's too much energy, sometimes it's too little energy. And also talking about the face, and because when we're working with the cosmetics, we work in the face, we work in the neck, and we work in the area of décolletage. These all areas are very different. The nose, the forehead, lips are more sensitive. So while you're working with the scanner on the face, you're allowed to change the energy, because otherwise it will be too much or too little. So don't be afraid like, oh, here he feels not that much, but here he feels too much. So you can totally lessen the forehead energy. And also here I will just talk about that sometimes you're working with the gels. When you're working on a dry skin, it's one energy. When you're working with gels, then it will be energy has to go down. Sometimes it might be like 2 or 3. If you work like area at the nose or area at the forehead, area around the eyes, it's pretty uncomfortable with the gels when you're trying to put the medicine into the body, right? So you have to make sure that it's very little, especially when you start. You better start somewhere on the forehead, like you did your décolletage, you did your neck, and then you go to the forehead. Make sure that you drop the energy before you go to the forehead, because otherwise you will shock a patient, he won't come back. She won't come back. Maybe he won't come back. So this is the energy treatment levels. Sub-threshold, you don't have any sensations, and that's when we work with the kids, just born kids, but the body still reacts to this treatment. Threshold, small sensations and vibrations, and that's what I would say you start with, because you have to just a little bit, especially for people, like when you work on yourself, you probably already know your tolerances, but when you start to work with a patient, with a new person, maybe it's your friend or family, you don't know their reactions, so start with the threshold, go to comfortable. And during the cosmetic procedures, we usually use comfortable, because face is already kind of more sensitive place out of the whole body, so you work with comfortable. And then there's a discomfort and pain when you're treating, but this is more for acute conditions when you need to diminish the pain. So mostly it's a comfortable threshold depending on the sensitivity of the patient. And you start with selecting again one energy, and then after you went through deciding what do you need, frequency, gap, intensity, and such, then you already will be working with different energy. So you move it to something maybe a little bit higher or sometimes lower. Again, so you start, for example, with frequency with energy 18 or maybe lower. If it's gel, definitely lower. Then you pick up the frequency, then you pick up intensity and gap, and then you can make energy higher or lower. The frequency is changed automatically when you put the bio function of the scanner. Okay, so the bio-controlled feedback, it will, like, the frequency will change automatically, the intensity will change automatically, and the gap. Okay, and this is to do something with what the body wants at this time, because intensity is working with the, like, either chronic condition or more acute condition, and the body asks for specific intensity. Same thing with the gap, it also will change according to whatever the body needs. And I don't know, like, there are a lot of new people, so the gap and the intensity, so if the frequency is how many signals are in 1 minute, intensity is how it's packed. Is it packed like 1, or it's 3 stimulus in 1 pack, or it's 5 stimulus in 1 pack, or it's 8 stimulus in 1 pack, right? And the gap is how much distance between these signals, the specs of the signals, right? So that's for those who don't know that, okay? It's usually in a new series of apparatus of the scanner devices when they have the certified bio regimes in this. Okay, so, and it's all changing, and it's good because that's when the body doesn't get used to the scanner signal. Okay, very new, probably like what, about 2 years, I think they started to do the 32 presets scanners, and this is your preset. So who doesn't have a scanner with preset and who has a lot of money, you might thinking of getting it because it's pretty convenient. You don't need to think like what do you need to do for certain diseases or for certain conditions, but you can just go and look like what the preset does and work with the preset. I'd like to have both, right? Because you can do something by yourself, and you can also take something which is already preset for you, right? Now, with anti-edema, swelling, and lymphatic drainage, we use those presets, right? For subacute pain, for trigger points, this is mainly for any kind of a pain on the face, right? Also, it's after some kind of like acute situation on the face, right? Acute situation on the face can be plastic surgery, it can be very deep extractions or very deep peelings. So in this case, you will definitely have a lot of pain on the face, so you can use these ones. For muscle stimulation, you can use small and large muscles. Facial muscles, usually you use more small muscles, right? Deep myostimulation, you use a lot on the face. Myostimulation, you use also on the face. Sometimes you can do like steam relax is the one which is kind of with AM, right? Amplitude modulation. It goes, it relaxes, and then contracts, relaxes. Very good for the muscles. Lymph drainage with the lymph preset and low FM is also needed. Now, cosmetology presets are slightly different. Some of them are coming up from the lymph, but you can use also preparation. You use a lot of preparation preset in the treatments. Myostimulation, relaxation of the muscles, small muscles myostimulation, labral lymph drainage, low frequency swing, surface myostimulation, and first aid emergency again. So, right, we will be talking about all of them, how we use them for the different scanner therapy treatments. Okay, so when scanner treatment was developed, nobody was thinking about beauty treatment at this time, but later it was already something to do, like, okay, what we can use it for else. And the, the beauty therapy was one of the big ones in the holistic and natural approach to cosmetology, to avoid sometimes fillers, sometimes Botox, sometimes plastic surgery, right? So we have pretty good results if you work, and we will be doing it later, if we work on the lines on the face, it's like a Botox treatment, right? If we work on the different types of hanging skin, sagging skin, also it will be like a plastic surgery. Or at least you can avoid it for a long period of time till you decide that now maybe I have to. And then it also helps with the results of the cosmetology treatment, like surgery. If you work before and after surgery, it heals very fast, very fast. It's like 3 times faster. The doctors who sent us patients after plastic surgery or before plastic surgery, sometimes it's mostly after, but even after, some people who are our patients and go for cosmetic surgery, they say that it's just like they amazed how fast it is. And the doctors are also amazed. So it does work, definitely. It eliminates scar tissue too, so it's better healing, plus the scar tissue becomes really not as noticeable, which is another good thing. Plus, no infection. Sometimes also you might get fever, but if you use scanner, it will adapt to your system and you're not gonna have fever. Because it works through the nervous system on the face, we work in face, neck, right? There is a lot of nerve endings in this area, which establishes body balance through also, there are facial nerves, which are cranial nerves, they're also coming here. So we work on the brain, we work on the rest of the body, because when the brain is balanced, everything else is balanced. We work on the areas on the face which belong to different organs. And that's why we also know that we will be able to help other organs in the body through the working on the face. And it also works as a whole body system work, right? So the whole body benefits from just working as a cosmetic acupuncture, scanner therapy. Some people can be really good looking and they don't have much of the facial damage, not much of the brown spots, not much of any kind of pimples or wrinkles, nothing much is sagging, but they still will have a very good results from it for the whole body, right? And let me see, I think I have to admit somebody else. Do I have to admit somebody? Not sure. Did I admit somebody? Probably did. Okay, so I will look in 5 minutes to see if any other more people trying to get in. Okay, so some people are very well good looking people, other people might be not as with the good skin, and it might be genetic, it might be the environmental, it might be something else, and we try to work on all of these issues. I'm not going to give you the disclaimer. You will read it by yourself. And we will go to facial rejuvenation. Okay, so here we will talk about, I will put the next slide, and here we will talk about the whole webinar today will give you a lot of different techniques. It will give you a lot of different parameters on which you work, some presets, some like with the Scenar Pro. And there are so many different information that you will try to figure out, okay, so what I do here, what I do here. First thing which you have to do, you have to look at your patient and see what the patient needs. Because every patient has different problems on the face. Some people have very little problems on the face and just want prevention of the problems. Other people have plastic surgery, so you know that you have to make your treatment towards the improvement after facial surgery, right? Some people have wrinkles, so you will be working mostly with wrinkles. And you start to put it as a protocol for each patient. So Mr. whatever Jones or Mrs. Silver, and you just put for these people the protocol before you try to start the treatment. So you see, because there are so many parameters, you have to write it down. That's what we do. I don't try to necessarily remember everything in my head. I'm doing the protocol. I'm doing, okay, so if I'm going to be doing the cleansing, what I'm going to be cleansing it with? Because people have different skin. Some people have oily skin. Some people have dry skin. There will be different cleansing. Sometimes it's more harsh for the oily skin. Sometimes it's something which is not as bad. For the dry skin, then we will do more kind of moisturizing treatment of the wash and the face, right? But you can use pretty much everything from soap to cleaning wipes to cleaning different gels, whatever else it is. Also balancing the skin, toning the skin, moisturizing it, and protecting it. And we will be talking about it all the time today. So also we need to see like whom we need to moisturize more, whom we need to tone more. Some people have a very good tone of the face, but they have dry patches of the skin or they have oily patches of the skin. So you have to make sure what you do for each patient, because all the people are different. It's not the same treatment for each one. That's why the protocol on a paper, you just sit with your computer or the phone or the just list of paper, and you make for every patient what you clean with, what you tone with, what the parameters for this person, and such and such and such, and what part of the treatment you can avoid. Because if you will do everything, whatever I'm giving you today, it will be 2-hour treatment. Okay, so some people would like 2-hour treatment, some people won't. So we're working with the whole complexion, and we're also targeting the problems. And when we're targeting the problems, that's the problem, whatever you will find on this patient specifically. And for this problem, you will put a little bit more time than for something else which is not as important, or you avoid certain parts of the treatment. So what it does for the facial treatment, it's a capillary enhancement. So because of the capillary enhancement, the circulation, the bringing food to the cells of the face will be better, so the sagging will get less. And if you will be like putting some anti-sagging treatment, it also will help. Lymphatic drainage, to kind of drain all the lymph with toxins. Sometimes it's also because it's a lot of teeth, sinus, ears, and if people have problems in these areas, they might also have problems of lymphatic congestion in the face area. And you have to make sure that all this congestion will be released prior to other part of the treatments. Then it goes myostimulation, electroporation, tissue permeability enhancement. That's where you do the electroporation, right? So you can move the medicines into the skin. Cellular activation, which increases the ATP synthesis, so the energy in the cell gets better and the cell starts to functioning better, and the appearance of the skin will get better because the cell is already different. The scale is already skin better after this. Anti-inflammatory, it's any kind of rashes, it's any kind of pimples on the face. Then autonomic nervous system balance through the face, so it will be a good mood after the Scenar treatment. Tissue immunity enhancement, yes, it's tissue immunity enhancement in the whole face, plus it also enhances the immunity of the body. And antioxidative effect. Okay, so reducing wrinkles, moisturizing, balancing excess of skin oiliness. So it's both, we balance the dryness and we balance the oiliness. Also fights premature aging. It accelerates repair of the skin and regeneration. It gets rid of the inflammatory skin diseases and accelerates of the collagen and the elastin synthesis of the skin. So that's where the skin becomes perfect. It pumps up, nothing is hanging, and this is great. Now, Here we go with like what we usually use for different types of skin conditions, skin problems. If you have any kind of forehead wrinkles, crow's feet wrinkles, nasal labial fold, any kind of on top of the lip sometimes it's a line which goes like in here. It's all mimic lines. And we use micro massage for it. If people will have double chin and age-related sagging of the face, then we do a lot of contouring massage to keep the face not thinning, but kind of nice. Dark circles under the eyes, it's not only the blood supply of lymph circulation, it's also, we have to work on the kidneys. By the way, that's what we're also talking about, that in certain conditions, we need to work on the organs. For example, right here, if you have dark circles under the eyes, it's also a good thing to work with the kidneys, right? Also good thing to work with the liver, because liver opens in the eyes. Dry, oily skin, excessive sweating, all this metabolic problems. Metabolic problems, it means that you also have to probably work on the abdomen. You can work also the hormonal zones, the palm zones, right? Acne, post-acne treatment, inflammation treatment, right? So it's all going to be described for you. And for edema, it will be the lymph drainage treatment, right? Next. So starting with cleansing, then you just wash on your face. And what we do usually, we apply some kind of a cleanser on the face. And if you don't have it, you don't need to do it. We put the photon lights on the face. It's this kind of a device, which is for about 15 minutes. It's working on the device. It's warming a little bit the face, and it helps to get the cleansing ointments a little bit deep in the face, so it will extract more dirt from it. Then we wash the face, right? And if people don't have this photon lamp, they can just put the hot towel, and there is also, they sell the masks, which is heating masks. You can put the heating mask on the face at this time, right? So, and you can leave it for like 10 minutes, 15 minutes. So the face will be clean when you are working with it. Then you do the Scenar general drainage techniques. Then you can do the facial peel, Scenar micro massage, Scenar contour massage, application of nourishing gels or some kind of medicine, whatever needs to be put on the face according to problems of the face. And then you do Scenar activation, which is also kind of like a massage, right? So the face at the end of the procedure will be nice, glowing red, and very good feeling of energy in the face too. Now, when we're talking about facial peel, I will talk about it later, and I will tell you what we use. So let's talk about the cleansing of the face, and then the drainage techniques of the face, right? So cleansing, we already kind of discussed what you can do about it. You can just wash your face with soap if you don't have time to do anything, or just wipe it. Especially, I would wipe, especially if you're gonna be working with the medicine, which you're gonna be the expiration into the skin, electroporation. So then it's good to cleanse the skin from the makeup which people have. Before, when we just started with the facial procedures, we were doing, how we called it? We called it lunch facial. So people were running to us during the lunchtime. They had about like a 40-minute treatment, 45-minute treatment with us. And we didn't clean the face much. We were just doing the Scenar therapy on the face. But then we started to develop more techniques, and we figured out that it's a very good thing to give better therapy, more therapy, not just like application of different like Scenar treatment without cleansing and anything else. So as you see here, it's the same thing, whatever was before, but just we put it in a nice way. So you do cleansing, then you do the drainage. If people already clean their face, they don't need to clean it if they don't want to clean it. Then we do the micro massage, then we do contouring massage, all this like medical application of gels and everything else. And then high frequency treatment. There is a tension. Why? Because when we're talking about using the gels on the face, we cannot use any metal gels. So there is a lot of interesting stuff coming up now as a gold mineral supplements, colloidal silver supplements. They cannot be used on the face with scanner, but you can definitely put it after you finish the procedure. You finish the procedure with scanner, you put your colloidal, whatever, silver, gold, and you can leave it. You can leave it like a, also a good thing to do the gold mineral or colloidal mineral mask, which is kind of a thick gel mask, which you put on the face after you did the scanner treatment to kind of like cool the face. Okay, so next thing is questions. I will stop sharing now. Actually, I don't need to stop sharing. You can just ask me questions, right? Oля, see if anybody wrote the question.
Yes, there were a couple of questions that we need to address. Like when talking about contraindications, you show 3 pictures saying that not to work on gallbladder, SP6, lung point. So do we never work on these points or just during the pregnancy?
Pregnant only, causes miscarriage. Everybody else is fine. Next.
Only first trimester, right?
No, always. With pregnant women,
Always.
for the first trimester, I would not take a patient.
Okay.
No, because it's like this is a precaution to many treatments, not only scanner treatments. They are so vulnerable, especially somebody who has a propensity to have a miscarriage. Don't touch them for 3 months. The first 3 months are the most important. If they wait for 3 months, it means that they're gonna keep. Usually, I mean, bad things happen too, but usually not. And that's why 3 months, don't touch them at all. And if you have already pregnant woman 3 months plus, then you don't work on these 3 points and you don't work over the abdominal area, right? I hope I answered the question. Next.
Next question was again about the contraindications. What about other types of cancer? And can the lymphatic spread the cancer through the body?
No, lymphatic doesn't spread the cancer through the body. You can work on cancer patients. You work mostly with the kind of 4 general treatments for the body, which is 3 lines, 6 points, the color zone, and also like abdominal zone. You can work with the general treatments, right? The palms or hormonal zone. These ones you can work with. You can work anywhere in the body, but you don't work over the projection of cancer. If we see, like, for example, it's liver cancer, you don't work on the liver. Okay?
Another question, and we get it a lot. We treat brown spots.
Okay, that's what we will be talking about, but later. We don't with the scanner therapy. It doesn't work. Okay? But it improves other places, and I will say about brown spots, what we can do about brown spots later when I will.
Okay. Also, maybe we can have some kind of recommendations on the good heating mask or some cleanses that you use, you know.
I did put the stuff which I use on the bottom for everybody to have. There's with the links even. And other,
yeah, I think that those were the recommendations, right?
Right. So recommendations below. Everything will be there. Okay. Any other questions?
Yes. About like the procedure, like when you start from the cleaning the face, like washing the face, we normally tell that like that's like the basics that the face need to have its information before you start doing scanner. So how does that work? Like how long do we wait from washing the face to start working on the face?
Pretty much right away we start working on the face, but we establish what we have to do with the face, when you just look at the person who comes to you, you ask questions also. You ask questions about their health, not just face, but how do you feel? How's your heart? How's your lungs? How's your liver? How your digestion is working, right? So because it's also important, we have to know, like, okay, if he has lines like this, it means that the intestine is not well. So I will definitely ask them. If I will look, we will be talking about this too a little bit later, because I will be showing you the page which shows like different skin lines and problems, different areas of the skin, what they belong to. And that's why you will ask like specific questions, knowing at what might be happening. So it can be, for example, high blood pressure. So you will ask about, like, if you will see on a face the indication for high blood pressure, I will just ask, do you have high blood pressure? Or if I have some kind of like a red nose, I will say, do you have any heart condition? Or if I will have, for example, kind of line which goes across the lip, I will ask, did you have your uterus removed? You know, so there are a lot of different things which you can find out looking at the person's face, person's body, his voice, smell, his other stuff. But again, this is just my kind of acupuncture degree helping too. But you will have a special picture and you can see where the problems are according to the different lines on the face, and you can ask these questions, which is also good. And they will say, oh, you're intuitive. You know what I have, which is also cool.